Vibrant seniors, welcome. Do your knees often feel stiff, achy, and perhaps even a little bit painful each and every morning? Is that familiar morning stiffness and those nagging aches slowing you down and preventing you from enjoying your day to the absolute fullest? If you are among the many people who experience that very familiar sensation of morning knee pain, then please know that you are certainly not alone, as this is an incredibly common issue, particularly as we get older. Many people experience that same sensation of discomfort, and it can certainly be very frustrating and even quite debilitating. But the good news is that you don't have to simply accept that knee pain is just a normal part of the aging process, and you also do not have to simply live with that pain, as there are many effective strategies that you can explore to alleviate the discomfort and also improve your overall mobility. It's all about becoming aware of the underlying causes of your pain, and also about making informed choices about your own health. Waking up with knee pain is something that is far more common than you might think, and it can often be a very significant barrier that prevents you from being as active as you would like to be, or from simply enjoying your day. We are here today to help you to uncover the real reasons behind this incredibly common issue, and also to provide you with a wide range of practical and actionable solutions that you can use every single day to relieve your discomfort and to take back control of your life. It's about empowering you with all of the knowledge that you need to live your life to the absolute fullest, free from pain and free from discomfort. We'll help you to understand why this is happening and what you can do about it. In today's video, we will delve into the various causes of that very familiar sensation of morning knee pain, and we'll also be providing you with a wealth of proven strategies that you can use to effectively manage and also to alleviate that pain. It's not about just accepting the problem, it's about actively seeking out solutions. We'll discuss everything from simple home exercises that you can easily include in your morning routine to lifestyle changes that will promote long-term health. We will also explore when it is absolutely essential to consult a medical professional. All of the information that we provide is designed to empower you to take proactive control of your health and your well-being. Welcome to Vibrant Seniors, your dedicated resource for all things related to healthy and fulfilling aging. Here at Vibrant Seniors, we are absolutely committed to providing you with all of the information, the guidance, and the support that you need to navigate the aging process with complete confidence, and also to maintain your health and your mobility for as long as possible. Our aim is to empower you to make the best possible choices for your health and to live your life to the absolute fullest at every stage of life. If you haven't already done so, then please subscribe to our channel and also click that notification bell so that you never miss any of the valuable content that we are bringing to you. We believe that knowledge is the first step toward change, and we hope to inspire you and support you on your health journey. Let's begin. Before we explore the specific reasons why your knees might be hurting each morning, it is very important that we take some time to understand the very basics of knee anatomy and the very vital role that each component of your knee plays in ensuring smooth and pain-free movement. The knee joint is a complex and fascinating structure that is made up of bones, cartilage, ligaments, and also synovial fluid, all of which work together in perfect harmony to allow for an incredibly wide range of movements. It is a masterpiece of biological engineering. Your knee joint is formed by three different bones: the femur, which is your thigh bone, the tibia, which is your shin bone, and the patella, which is your kneecap. These bones all work together to provide structure and support, but they also need to move in relation to each other to provide you with the full range of motion that you need to be able to perform your daily tasks. The ends of these bones are covered with a very smooth tissue called articular cartilage, which acts as a cushion and also reduces any friction between the bones during any movements. This cartilage is very important for smooth and pain-free movement, as it prevents any bone-to-bone contact. In addition to bones and cartilage, your knee also contains ligaments, which are strong bands of connective tissue that help to stabilize the joint and they also provide support for all of the various movements that you are doing. The ligaments connect the bones together, and they prevent excessive movement or dislocations, and also keep the knee joint stable. Your ligaments are absolutely vital for providing all the support and stability that you need while you are moving. Your knee joint is also surrounded by a capsule, which contains a very special fluid called synovial fluid. Synovial fluid is a very thick and lubricating fluid that helps to reduce friction and also to cushion the joint, making it easier for your bones to move smoothly and also protecting them from any damage. This fluid acts like a lubricant, ensuring that the joint can move easily and freely without any discomfort or pain. It also provides a source of nourishment to the cartilage and helps to keep it healthy and functioning correctly. All of these components work together in perfect harmony to provide smooth, pain-free movement. Understanding the crucial role that each of these components plays, it is absolutely essential to understand why pain can occur and what you can do to address it. The more you understand, the more empowered you will be to take the right actions. It's not about accepting the pain, it's about making informed choices to address the underlying causes. Your knees are vital for your mobility, and it is important that you take good care of them. Now that we understand the basic anatomy of the knee, let's explore why morning knee pain is so often different from the pain that you might experience later in the day. It's important to understand this distinction, as this will help you understand some of the underlying causes. Morning knee pain is very often characterized by a very noticeable sensation of stiffness and achiness that tends to improve as you become more active throughout the day. This is something that is very different from the type of knee pain that you may experience after overuse or after specific injuries. The distinct nature of morning pain often gives very valuable clues about the underlying mechanisms involved. One key reason why morning knee pain is often different is that it is very closely linked to periods of inactivity and, particularly, to sleep. When you are asleep and not actively moving around for a prolonged period of time, your knee joint is not receiving the regular movement that it needs to maintain lubrication. Synovial fluid, which we discussed earlier, needs regular movement to properly circulate and also to help to nourish your cartilage. Prolonged inactivity can cause this fluid to thicken and also to accumulate within the knee joint, and that can lead to the very noticeable sensation of stiffness and discomfort that you often experience in the morning. In addition to these changes, the muscles and ligaments surrounding your knee joint can also become tighter and less flexible after prolonged periods of inactivity. This can also contribute to that feeling of stiffness and achiness that many people experience, and it is why movement is so very important. It also explains why the pain tends to improve as you become more active during the day. Movement helps to increase blood flow to the area. It also lubricates your joints, and it helps to stretch out all of the surrounding soft tissues, reducing stiffness and also relieving pain. And this will make you feel much more mobile and comfortable during the day. It's also incredibly important to connect this to some of the common experiences that many older adults have. As we get older, many of us will experience some degree of morning stiffness and pain due to some of the natural changes that occur in our bodies as we age. However, it's important to understand that it's not just about aging, it's also about the cumulative effects of inactivity and also other lifestyle choices. While these changes can feel frustrating, it is absolutely essential to understand that there are many effective ways to manage this and also to alleviate your pain so that you can enjoy a more active and fulfilling life. It is not something that you should simply accept as a normal part of aging, and there are a great many things that you can do to address it. It's all about making informed decisions and being proactive about your health. Now that we have an understanding of the basics of knee anatomy and also the reasons why morning pain is so distinct, let's delve into some of the specific causes of why you may be experiencing this very familiar morning discomfort. And let's begin with our first and very common cause, osteoarthritis or OA. Osteoarthritis is a very common degenerative condition that primarily affects the cartilage of the joints, and it is often a very significant contributor to morning knee pain and stiffness, especially for those over the age of 60. It is something that should be understood so that you can make the right choices about your own health and well-being. Osteoarthritis is a very chronic condition that involves the gradual breakdown of the articular cartilage, which is the smooth and slippery tissue that covers the ends of your bones. As we discussed earlier, this cartilage acts as a cushion, and it also reduces friction between the bones, allowing for smooth and pain-free movement. However, in people with osteoarthritis, this cartilage can break down over time, leading to a range of very uncomfortable symptoms, including pain, stiffness, and also reduced joint mobility. It's a condition that develops slowly over time and can become increasingly problematic. The exact cause of osteoarthritis is often not fully understood, but it's generally believed to be caused by a combination of factors, such as the wear and tear of the joints over many years, genetic predisposition, injury, and also other lifestyle factors such as being overweight or a sedentary lifestyle. It is often a complex and multifactorial issue that can have many underlying causes. It's important to note that it is not just an inevitable consequence of aging, and there are many things that can be done to manage the symptoms effectively. The reason why osteoarthritis often causes morning pain is that the breakdown of cartilage can lead to inflammation, stiffness, and pain, which are all most noticeable after long periods of rest or inactivity, such as sleep. When you are not moving your knees for several hours, the joints can often become stiff, and the surrounding muscles and soft tissues can also tighten, all of which can lead to increased discomfort. The longer that you have remained still, the more stiff and painful the joint will feel until you begin moving again. This is why those first few steps in the morning can often feel so very uncomfortable, and why your pain may also feel worse in the mornings. The symptoms of osteoarthritis are not only limited to the mornings and can often affect you at other times too. However, it is often the case that the symptoms are worse in the morning or after any period of rest. You may also experience pain during the day, especially after periods of activity or extended periods of standing or sitting. Other common symptoms of osteoarthritis include stiffness, reduced range of motion, which means that it may become more difficult for you to fully bend your knee or to fully straighten it. You might also experience creaking sounds in your knee when you are moving it. These are all very common symptoms of osteoarthritis, and if you are experiencing them, it is best to have this assessed by a medical professional. It is very important to know that, while osteoarthritis is a very common condition, particularly among older adults, there are still a wide range of different and very effective ways to manage the associated pain, and also to improve your quality of life, so that you can continue to live a full and very active life for as long as possible. A diagnosis of osteoarthritis is not the end of the world, and it does not mean that you must simply accept a lifetime of pain and discomfort. There are a great many things that you can do to improve your situation and to make your symptoms much more manageable. It is, therefore, very important to seek professional guidance. Now, let's explore our second common cause of morning knee pain, which is inflammation and also fluid buildup. Inflammation is a very complex process that is vital for healing and also for protecting your body. However, excessive inflammation can also contribute to pain and discomfort, particularly in the joints. It is a delicate balance between healing and inflammation, and we need to make sure that we manage this process effectively. It is also important that we are aware of all of the potential issues that may be involved. Inflammation is a natural response of your body to injury, infection, or irritation. When there is damage or stress on your body, your immune system is activated, and this can lead to inflammation as the body attempts to repair the tissues. This is a very normal and natural response of your body. However, in certain circumstances, this inflammatory response can also become problematic. In the context of your knee pain, inflammation can very often contribute to stiffness and pain, particularly in the mornings after you have been resting. inflammation is often linked to many underlying conditions, such as arthritis, which includes both osteoarthritis and also rheumatoid arthritis, as well as injuries such as sprains and also strains or overuse from repetitive activities. When there is inflammation in the knee joint, there can be a release of various chemicals that can sensitize the nerve endings, and this can lead to increased pain and discomfort, and it is for that reason that you might often experience pain and swelling during a flare-up of inflammation. This inflammatory process is often one of the most significant reasons for morning pain and for feelings of stiffness. In addition to inflammation, the buildup of fluid, also known as effusion, in your knee joint can also contribute to morning pain. Synovial fluid, which we discussed earlier, is a very thick and lubricating fluid that cushions the joints and also helps them to move smoothly. However, if there is any inflammation, injury, or any other kind of irritation in the knee joint, your body may also produce an excess of synovial fluid, and this fluid can then accumulate in the joint space, and that can lead to swelling and also stiffness and pain that is very often most noticeable in the morning. During sleep and periods of inactivity, this synovial fluid tends to collect in the knee joint, and that can lead to that feeling of fullness and also stiffness that is often so noticeable when you wake up in the morning. The muscles and ligaments surrounding your knees may also tighten up during prolonged inactivity, further exacerbating the issue and compounding those feelings of discomfort and pain. However, as you start moving around during the day, you may also find that the excess fluid begins to circulate and it is absorbed by the body, leading to a gradual reduction in any swelling and any pain that you may be experiencing. It's also important to briefly differentiate between acute inflammation and also chronic inflammation. Acute inflammation is often a short-term response to an injury or an infection, and it usually subsides quite quickly as your body begins to heal itself. However, chronic inflammation is a much longer-term issue that can often develop over an extended period of time, and it is associated with long-term conditions such as arthritis. The management strategies for these two different types of inflammation can often be very different, and that's why it is so important to seek professional medical advice for an accurate diagnosis. In summary, inflammation and also fluid buildup are both common causes of morning knee pain, and they can often contribute to that feeling of stiffness and that nagging pain that many people experience every single day. It's important that you understand these underlying processes so that you can make the best choices about managing your pain and also improving your overall well-being. It's all about being proactive about your health and understanding your body's various signals. It is very important to pay attention to your body and also to recognize the symptoms that you are experiencing so that you can seek help as and when you need it. Now, let's move on to our third common cause of morning knee pain, which is the impact of inactivity and also poor circulation. As we have already discussed, inactivity, particularly over prolonged periods of time, such as during sleep, can have a very significant effect on your knees, and it can contribute to that feeling of stiffness and also pain. Therefore, it is essential that you are aware of the risks and also the underlying processes that contribute to this so that you can make better choices about your own health. Prolonged periods of inactivity during sleep and also during prolonged periods of sitting can often contribute to stiffness and pain in the knees, and that is why this is a very common complaint. When you are not moving, your joints do not receive the regular movement that they need to maintain proper circulation and also maintain the synovial fluid. As we have discussed, synovial fluid needs regular movement to properly circulate and also to provide nourishment to your cartilage and to keep it healthy. If you are not moving, the synovial fluid tends to collect in the joint and it can thicken, which then causes stiffness and also pain. The muscles and ligaments surrounding your knee may also become very tight during periods of inactivity, which further exacerbates those feelings of discomfort. In addition to the lack of movement, poor circulation, which is a very common issue among many older adults, can also worsen the situation. Reduced circulation slows down the healing process, and it also reduces the flow of nutrients to the area, and also the removal of any inflammatory substances from the knee joint. As we get older, the blood vessels can often become less efficient, and this may cause it to take longer for blood to circulate, and it also means that any damage or inflammation can take much longer to resolve. Therefore, it is incredibly important to maintain proper circulation to ensure that your body can properly heal itself and that your body is receiving all of the essential nutrients that it needs. Poor circulation can also exacerbate the buildup of fluid in the knee joint, as it can hinder the body's ability to effectively reabsorb any excess fluid that may accumulate during sleep. When combined with any inflammation and also with the lack of movement, the effects of poor circulation can lead to a greater degree of stiffness and pain, and this is something that needs to be addressed with proactive changes. It is all about understanding how inactivity and poor circulation can all affect your knee joint, and this will help you to make the right choices. It is also important to mention that your daily lifestyle choices also play a very important role in these issues. A sedentary lifestyle, where you are sitting for long periods of time and not moving frequently, can often worsen those feelings of stiffness and also pain, whereas regular, gentle movement can often promote better circulation and also help to keep your joints lubricated and flexible. Therefore, engaging in regular physical activity is essential for maintaining the health of your knee joints and for also avoiding the negative effects of prolonged periods of inactivity. It's important to recognize the power of movement and the importance of making it a part of your daily life. In summary, inactivity and poor circulation are significant contributors to morning knee pain, and they are problems that are often overlooked. It's about understanding that movement is absolutely essential for joint health, and that prolonged periods of inactivity can have a very negative effect on your overall health and well-being. Therefore, we must all be proactive about making sure that we are incorporating regular physical activity into our daily routines. It's all about being aware of the needs of your body and ensuring that you are meeting them. This understanding is crucial to making better choices to protect your joint health. Let's move on now to our fourth cause of morning knee pain, and that is the potential role of underlying medical conditions. While we have already discussed osteoarthritis as a very common cause of morning knee pain, it is also incredibly important to understand that there are other medical conditions that can also potentially contribute to that stiffness, pain, and discomfort that you may be experiencing every morning. It's important to have all the information so that you can be fully aware of all of the potential underlying issues that may be present. While OA is a very significant cause of joint pain for many older adults, it is essential to be aware of other medical conditions that may also be responsible for your symptoms. It's important to explore all of the potential causes so that you can take the right steps to manage the issue effectively. This is not a one-size-fits-all problem, and we all need to understand what may be causing our pain. There are a range of specific conditions that may cause pain in your joints, and these include rheumatoid arthritis, which is an autoimmune disease that can cause chronic inflammation in your joints. It is an inflammatory condition that can cause similar symptoms to osteoarthritis, but often requires very different approaches for its management. Another possible cause is gout, which is a form of arthritis that is caused by a buildup of uric acid crystals in the joints, and this can cause sudden, severe pain and also inflammation. Psoriatic arthritis, which is a chronic inflammatory condition that can affect the joints and also cause skin issues, can also be a potential cause of pain. In addition to these conditions, other autoimmune diseases, such as lupus, can also contribute to joint pain and also inflammation. Lupus is a complex autoimmune condition that can often affect a wide range of different parts of the body, including the joints. Lyme disease, which is caused by the bacteria that is transmitted through tick bites, can also lead to joint pain and inflammation, and it is important to be aware of this if you have had any potential exposure to tick bites. And finally, some other conditions such as bursitis, which is inflammation of the fluid-filled sacs that cushion your joints, and also tendinitis, which is inflammation of the tendons, can also cause significant pain in the knees. It is also incredibly important to understand that these various medical conditions can all have their own specific causes, and also their own individual management strategies. And that is why it is essential that any persistent morning knee pain should always be thoroughly evaluated by a medical professional, who can then properly diagnose your condition and also develop a very tailored and personalized treatment plan for you. It is very important that you seek professional advice so that you are fully aware of the underlying cause of the pain that you are experiencing, so that you can take the correct action. Self-diagnosis is never advisable, and you should always seek out the support of a qualified medical professional. It's also important to remember that early diagnosis and also early treatment is incredibly important in managing these various underlying medical conditions. The sooner you seek medical advice, the more likely it is that you can effectively manage your symptoms and also slow down any progression of the disease and also prevent any potentially severe complications further down the line. Therefore, it is always best to seek professional medical attention at the first sign of any concerning symptoms. A correct diagnosis is the most important first step in managing your overall well-being. In summary, while osteoarthritis is a very common cause of morning knee pain, it is absolutely vital that you consider the potential of other underlying medical conditions that may also be contributing to your symptoms. If you are experiencing persistent or worsening knee pain, then it is always best to talk to your doctor and also to seek professional help so that you can get a correct diagnosis and also so that you can receive the most appropriate treatment plan for your own individual circumstances. Do not try to self-diagnose and always seek professional advice when necessary. Your health is always the priority. Now that we have explored the various causes of morning knee pain, let's move on to some of the many effective solutions that you can use to alleviate your symptoms and also to improve your overall joint health. We will start by focusing on a solution that many of you will find very accessible and very easy to incorporate into your daily routine, and this is the importance of gentle morning movement. It's all about being proactive and about taking action that supports your health and well-being. Gentle morning movement is an incredibly effective way to alleviate any stiffness that you are experiencing in your knees and also to improve your mobility, especially first thing in the morning. Engaging in regular and low-impact exercises in the morning is far better than remaining inactive. It can help to lubricate your joints and also to improve your circulation, which then reduces stiffness and also relieves pain. It is important to start gradually and to avoid any strenuous activity that might cause you any further discomfort. Gentle exercises, such as these, are what you need in the morning and not high-intensity activity. There are some very specific, low-impact exercises that are particularly effective, and these can be easily incorporated into your morning routine. One of these is the simple knee bend, where you slowly bend your knees slightly, and then you straighten them again. You should repeat this exercise several times in a smooth and gentle motion while maintaining a slow pace throughout the exercise. You should also try leg raises, where you gently lift one leg at a time and then you slowly lower it again, also doing this several times. You should also perform some ankle circles, where you rotate your ankles gently in both directions to improve flexibility and circulation. And finally, you should incorporate some gentle stretches, such as hamstring stretches and calf stretches, to help your joints to move more freely and also to reduce any tension in the surrounding muscles. All of these exercises are easy to do and very effective at alleviating any pain that you may be experiencing. It is incredibly important that you always do these exercises slowly and gently and also that you stop immediately if you experience any pain. You should never push your body beyond its limits, and you should always listen to your body's signals. The goal here is to promote comfort and to improve your mobility, not to cause you further discomfort. Therefore, always be mindful of your own limitations. Your comfort is always your main priority. These exercises should also be performed on a stable surface, such as the floor or a firm bed, to reduce your risk of any falls. Therefore, always take care when you are performing these exercises. These gentle movements provide several different benefits for your knees. Firstly, movement helps to lubricate your joints, and this will enable them to move more smoothly and with less stiffness. The movement also helps to increase blood flow to the area, which promotes healing and also helps to reduce inflammation, and it also helps to relax the surrounding muscles and ligaments, reducing stiffness and pain. It's also important to understand that consistency is key here. These exercises should be done on a daily basis for the most effective results. They should be made a routine and an integral part of your morning so that you can maintain the health of your knees in the long term. They are also an excellent way to warm up your body before you start your day. In summary, gentle movement is an incredibly effective way to relieve morning knee pain and also improve your mobility. It's a simple, accessible, and a very gentle method that can easily be included in your routine and that can provide some very noticeable benefits. If you make this a part of your daily life, you will see real improvements and your knees will thank you for it. It's all about making small, positive changes that will have a major impact on your health and your well-being, and that will empower you to make better choices about your overall health. Your health is important, and you should make it your priority. Now, let's move on to our second very effective solution, which is targeted stretching. Stretching is an incredibly valuable practice that can significantly improve the flexibility and the range of motion of your knees and also alleviate stiffness and any related pain. It's not just about warming up your muscles, it's about promoting overall joint health and also helping you to feel more comfortable and more mobile throughout your daily routine. It is a very important practice that should be included in your daily life. Stretching helps to lengthen the muscles and the connective tissues around your knee joint, and this can help to improve flexibility and also to reduce any tension that can contribute to stiffness and also pain. Stretching can also help to improve the circulation by increasing the blood flow to the muscles and tissues, and this can help to reduce any inflammation and promote the healing process. Stretching is incredibly beneficial and can help to address some of the common symptoms of morning knee pain, such as stiffness and limited mobility. The more flexible your knees are, the easier it will be for you to move and the less pain you will experience. There are some specific stretches that you should be performing that are particularly effective for improving flexibility and relieving tension around your knees. One such stretch is the quadriceps stretch, where you gently pull your heel towards your buttock and hold the stretch for approximately 20 to 30 seconds, ensuring that you are doing it gently and without overstretching the muscle. You should repeat this stretch a few times on each leg. Another essential stretch is the hamstring stretch, where you sit on the floor and you extend one leg, and then you gently lean forward from your hips, keeping your back straight, and you should hold this stretch for 20 to 30 seconds and repeat on the other leg. It is very important to maintain a smooth and gentle movement to avoid any potential injury. You should also incorporate calf stretches, where you lean against a wall with one leg straight behind you and the other leg slightly bent in front. Then you should gently lean into the stretch until you feel a stretch in your calf and hold it for approximately 20 to 30 seconds and repeat on the other side. And finally, you should also perform some very gentle hip stretches, as tightness in your hips can also contribute to knee pain. A gentle hip flexor stretch or a figure 4 stretch will help to promote relaxation and reduce any tension in the hips and also in the surrounding tissues. Again, you should always hold any stretch for around 20 to 30 seconds and repeat on each side. It is very important that you breathe deeply during each stretch, as this will help you to relax your muscles and also enhance the effectiveness of the stretching process. It is also incredibly important that you always pay close attention to maintaining your proper form while you're stretching, and that you also avoid any overstretching, as this can lead to injury. All stretches should be performed in a slow, controlled way without any sudden or jerky movements. You should always listen to your body and only stretch to a point where you feel a gentle tension, and you should never force your muscles beyond their limits. If you experience any pain, then stop immediately and then rest. Your comfort is always paramount. If you incorporate a simple but effective stretching routine into your daily morning routine, you will see a dramatic reduction in any stiffness, and also a great improvement in your mobility, and you will set yourself up for a day with far less pain, and also with far more freedom of movement. Stretching is a very powerful tool that you can use to take control of your joint health and to enjoy a much more active and fulfilling life. It's about making choices that nourish your body and that help to keep you healthy and active for as long as possible. It is also incredibly important that you are being kind and gentle to your body at all times. Now let's move on to our third solution, which involves the use of heat or cold therapy. Heat and cold therapy are incredibly simple, yet very effective tools for managing pain and stiffness in your knees, and these two options can often complement each other and can have an incredibly powerful impact on your pain management. Heat and cold are very easily accessible tools that can offer some very significant relief from your pain, and therefore they are often very beneficial to many people. Heat therapy is particularly useful for relaxing muscles, reducing stiffness, and also for alleviating pain, and it is something that can be particularly beneficial before you begin your daily routine. Applying a warm compress to your knees for about 15 to 20 minutes before you begin any exercises or before you begin your day can help to relax the muscles around your knee joints and also prepare them for activity. Heat therapy can also help to improve your circulation, and this can bring more nutrients and oxygen to your joints, which can promote the healing process and also help to manage any discomfort that you may be experiencing. A warm shower can also be an excellent way to relax your muscles and to also help to improve your circulation and also prepare your body for the day ahead and for any activities that you may wish to perform. Cold therapy, on the other hand, is incredibly useful for reducing inflammation and also any swelling in your knee joint. If you are experiencing acute inflammation, you should apply a cold compress or an ice pack wrapped in a thin towel to the affected area for about 10 to 15 minutes. The cold will help to constrict your blood vessels, which can reduce the blood flow to the area and also reduce swelling, and this will make it far easier for your body to heal. It can also provide pain relief by numbing the nerve endings. Cold therapy is particularly helpful if you are experiencing any swelling or any inflammation, as this is an excellent way to reduce those issues. It is also incredibly important to understand that both heat and cold therapy can have very different effects on different individuals, and therefore, it is always important to experiment to find out which works best for you. Some people may find that they respond better to heat, while others may find that they have much greater relief from cold. It is essential that you try both methods to find out what works most effectively for you and to make sure that you are able to manage your pain as effectively as possible. You can try one option for a few days and then the other and see which is most effective in alleviating your pain. If you are ever unsure, please talk to a medical professional for more personalized advice. In summary, heat and cold therapy are incredibly powerful and incredibly simple tools that you can use to manage your knee pain. Heat can help to reduce stiffness and also relax muscles, while cold therapy can help to reduce inflammation and also swelling. By understanding these differences and by knowing how they work, you can make the best use of these methods to better manage your symptoms and also to improve your overall knee health as you explore all of the options that are open to you. It's all about becoming your own best advocate for your own health and understanding all of the ways that you can help yourself to feel better. Your health and well-being should always be your priority. Let's move on now to our fourth and equally important solution, which is the importance of maintaining a healthy weight. Maintaining a healthy weight is incredibly vital for your overall health, and this is particularly true when it comes to the health of your knee joints. It is often something that is overlooked, but it can have a very significant impact on your overall well-being. Your weight directly impacts the stress that is placed on your knees, and therefore, it is something that needs to be addressed. Excess weight can place a very considerable additional stress on your knee joints, and this will contribute to that feeling of pain and also discomfort that you are experiencing in the mornings and often throughout the day. Every extra pound of weight places a greater burden on the cartilage, ligaments, and also the bones in your knees, and this will accelerate the wear and tear of these essential structures, increasing your risk of developing osteoarthritis or aggravating pre-existing conditions. The extra weight places unnecessary pressure on your knees, which makes them work harder to support your body, and this, in turn, can exacerbate your joint pain. Your weight is something that needs to be carefully managed. In addition to increased stress, being overweight can also contribute to inflammation throughout your body, including in your joints. Fat tissue can often produce inflammatory chemicals, which may then worsen the pain and the stiffness in your knees and also contribute to joint damage, and it can also hinder your body's natural ability to repair itself. Excess weight is often one of the major factors that is involved in chronic inflammation, and therefore, it is incredibly important to address it if you are experiencing knee pain or any other form of pain in your joints. It's all interconnected. Therefore, maintaining a healthy weight through a balanced diet and regular exercise can significantly reduce the strain on your knees and also reduce your risk of developing or exacerbating any knee problems. It is not just about losing weight, it's about maintaining an overall healthy lifestyle that nourishes your body and also supports optimal joint health. It's about making sustainable choices that will help you over the long term and to empower you to live a long and healthy life. It is important that you focus on sustainable strategies for weight management rather than resorting to any drastic dieting or rapid weight loss programs. A slow and gradual weight loss is far more sustainable for your long-term health. You should always aim for a balanced diet that is rich in fruits, vegetables, lean proteins, and whole grains, and also try to engage in regular physical activity to burn more calories and to also strengthen the muscles around your knees. A balanced diet that is combined with regular exercise is the key to long-term and sustained success. Regular, gentle exercise is also incredibly important, as this will not only assist in maintaining a healthy weight, but it will also strengthen the muscles around your knee joints, and this can offer increased support and also stability, and it also reduces any stress on your joints. So to summarize, maintaining a healthy weight is absolutely essential for protecting your knees and also for reducing your morning pain. It's about understanding the connection between your weight and also the stress placed on your knees, and also about adopting a holistic and sustainable approach to weight management so that you can enhance your long-term health and your well-being. It is not about short-term solutions, it's all about establishing long-term habits. Remember, small, consistent choices can have a huge positive impact on your health. Now, let's delve into our fifth solution for managing morning knee pain, which focuses on the use of various supportive aids. While these aids cannot address any underlying causes of your pain, they can often provide very valuable support and also pain relief, as well as significantly improving your overall mobility. They are an incredibly useful tool that you can explore to help you manage your symptoms while you work on all of the longer-term strategies. Supportive devices can often be very useful in providing additional stability to your knee joint and also reducing any stress that you are experiencing. They can help to improve your balance, and they can also make it easier for you to perform your daily activities while also reducing the risk of further injury. It's very important to understand that supportive aids are just that, and they should always be used in conjunction with other methods of pain management, such as the exercises, stretches, and lifestyle choices that we have previously discussed. They are all components of your overall wellness strategy. There are a range of very different assistive aids available that can be very beneficial for managing morning knee pain. One such aid is the knee brace. Knee braces can often provide additional support and stability to your knee joint, and they can often reduce any pain and also inflammation. These can be particularly useful when you are engaging in any physical activity or also during periods of discomfort. The type of brace that you use should be based on your personal needs and also your medical condition, so it is vital that you seek professional guidance on the correct style of brace for you. Your comfort and also your overall stability should always be the main priority. Another useful aid is arch support insoles. Arch support insoles are special shoe inserts that can provide additional support to your feet, and this can help to improve your alignment and also to reduce any stress on your knees. The arches of your feet and the alignment of your legs are all directly connected to your knees, and therefore, using arch support insoles can often have a very positive impact on your knee pain. They help to promote better alignment, and also they can help to absorb shock, which is incredibly beneficial for reducing any pressure on your knee joints. Finally, other supportive aids, such as walking sticks or canes, can also provide additional stability and also support for those who may have mobility issues. These walking aids can help to take some of the stress and strain off your knee joints, and they can also improve your balance and reduce your risk of falling. Walking sticks and canes can also give you more confidence while you are moving and can help you to stay active, even when you are experiencing some pain or stiffness. You must always use them correctly so that you are maximizing all of their benefits. It is vitally important to emphasize that you should always seek advice from a medical professional or a qualified physical therapist before you begin using any supportive aids. They are the best people to assess your particular needs and also to recommend the most appropriate type of aid, and also to ensure that you are using it correctly. You should always get professional advice on the correct usage of any device, as this will not only help to ensure that it is effective, but it will also reduce your risk of injury. This is a very important step in ensuring that you are choosing the correct options. In summary, supportive aids can be a very valuable addition to your pain management strategy, and they can provide very important support and also pain relief, while also improving your mobility. They should always be used in conjunction with all of the other strategies that we have already discussed, and you should always make sure that you seek advice from a medical professional before you start using them. It's all about making informed choices and also about taking a multifaceted approach to managing your knee pain and also improving your overall quality of life. They are simply another tool that you can use to take care of yourself. Now, let's turn our attention to our sixth solution, and this is incredibly important: consulting a healthcare professional. While all of the solutions that we have discussed today can be very useful in managing your knee pain, it is absolutely essential that you also seek professional medical advice and also treatment for any underlying causes that may be present. You must understand the limitations of self-management and also understand the absolute importance of professional diagnosis. I want to reiterate that the information provided in this video is intended for educational purposes only and should not be seen as a substitute for a professional medical diagnosis or a tailored treatment plan designed for your specific needs. It is absolutely essential that you always talk to a qualified medical professional for any health issues and that you always seek personalized medical advice so that you can take the best choices for your own individual circumstances. They are the best people to assess all of your personal needs and to offer guidance and support that is directly relevant to your individual circumstances. You should always seek professional medical advice if you are experiencing severe pain, swelling, any reduced range of motion, or any other concerning symptoms that are persistent or that worsen over time. If your pain is impacting your ability to perform your daily tasks, or if it is significantly reducing your quality of life, or if you are experiencing any sudden onset of pain, then these are all signs that you should make an appointment with your doctor as quickly as possible. It's important to listen to your body and to seek out the help that you need when it is necessary. Early intervention is always the best course of action. Your doctor can perform a very thorough physical exam, and they can also order any necessary tests to determine the underlying cause of your knee pain, and also to rule out any serious medical conditions that may be present. They can also provide you with an accurate diagnosis and also develop a treatment plan that is specifically tailored to your individual needs and also your personal circumstances. This may involve medication, physical therapy, or other interventions. A tailored plan is essential for long-term management of your condition. It's also very important to understand that early diagnosis and treatment is absolutely key in managing chronic conditions such as osteoarthritis and other underlying causes of knee pain. Early intervention can often slow the progression of the disease, and it can also prevent any potential complications and also enable you to manage your symptoms more effectively. Therefore, it is always best to seek medical attention sooner rather than later so that you can address any issues that may be present as soon as you possibly can. Early action always leads to the best outcomes. In summary, while we have provided you with a range of different and effective solutions that you can use to manage your knee pain, it is always imperative that you are also consulting with a healthcare professional to ensure that your underlying condition is properly diagnosed and managed, and that you are getting the best possible care for your own individual circumstances. Self-management is good, but professional advice is absolutely essential. You should always be your own advocate for your own health and seek professional advice when you need it. Now that we have covered all of the various solutions, it's absolutely essential that we take some time to emphasize the importance of consistency. While the solutions that we have already discussed can all be very effective, they will only provide the best results when they are practiced consistently and regularly. Consistency and daily practice are absolutely key for long-term management of your pain and also for promoting optimal joint health. It's not about doing things occasionally, it's about making them a part of your daily routine. It is incredibly important to make all of the solutions that we have explored an integral part of your daily life, and also to try your best to maintain this consistency over the long term. This means making gentle movement and also targeted stretching a part of your daily routine, incorporating good quality nutrition into your daily diet, and also being mindful of maintaining a healthy weight. It also means that you should be using heat and cold therapy when it is necessary to manage your pain. And you should also be making sure that you are seeking out the support of a medical professional when you need it. All of these steps should become as normal to you as brushing your teeth or any other daily routine that you follow. A holistic approach is also essential for managing any kind of chronic conditions. Combining all of these various strategies, such as movement, stretching, heat or cold therapy, weight management, and appropriate medical interventions, will often provide you with the best possible results and also help you to manage your pain much more effectively. It's not about relying on one single method. It's about using all of the different tools and strategies available to you to address the issue from multiple angles. The combination of approaches is more powerful than any one single approach. It's also absolutely vital to remember that progress can take time, and also that you should always remain patient and also persistent with your efforts. Do not expect results overnight, as it may take some time and consistent effort to see any significant improvements in your pain and also in your overall mobility. It's very important to be kind to yourself and also to be compassionate and not to give up, even if you don't see immediate results. Your persistence will always pay off. It's a journey, and you should keep on going, even if there are times when you feel that your progress is slowing down. In summary, consistency and daily practice are absolutely key for long-term pain management and also for promoting optimal joint health. It's all about making a commitment to yourself and to adopting a holistic approach and also sticking to your chosen strategies over the long term. It's about believing in your capacity for change and also having the patience and persistence that you need to achieve all of your goals. Remember, small daily actions can lead to significant and lasting improvements in your overall health and well-being over the long term. You can do this. Now, let's take a moment to explore a couple of additional tips that can further enhance your efforts in managing your morning knee pain. These are some very simple strategies that are often overlooked, but they can have a very positive impact on your overall well-being and also your knee health. These simple strategies should also be included in your overall strategy for managing your pain so that you are considering all options. One useful tip is to carefully consider your sleep position and to make sure that you are using a position that properly aligns your spine and reduces any stress on your joints. You can try sleeping with a pillow between your knees, which will help to align your spine and also to reduce any stress on the joints. Sleeping with a pillow between your knees will also help to prevent any twisting or turning of your spine, and it also helps to keep your hips and your knees in a more neutral position. This can be particularly beneficial for those who sleep on their side, as it will help to reduce any pressure on your knees. You can also try sleeping on your back with a small pillow under your knees for added support. Another incredibly important factor that you may not have considered is the quality of your mattress. A good quality mattress is essential for promoting proper spinal alignment and also for reducing any pressure on your joints. An old or unsupportive mattress may cause you to twist or turn during your sleep, and it can also contribute to stiffness and also pain in your knees. Therefore, you should make sure that you are sleeping on a firm mattress that supports your body in a neutral position and also helps to minimize the stress on your knee joints and also on your spine. A good quality mattress will help to reduce your overall level of discomfort and help you to sleep much more comfortably at night and also prepare you better for the following day. These additional tips, while seemingly minor, can have a very significant positive impact on your overall sleep quality and also on your joint health. A good night's sleep is essential for your body's natural healing processes, and making sure that you are sleeping in a comfortable position on a supportive mattress can make a very big difference to how you feel when you wake up in the morning. It's all about paying attention to those small but very important details that can greatly enhance your overall well-being. It is also about respecting the needs of your body and making sure that you are always providing it with all of the support that it requires. Now that we have thoroughly explored the causes and also the solutions for morning knee pain, let's recap all of the key solutions that we have discussed in today's video so that you are fully aware of them and you have a better understanding of all of the various options that are open to you. This will help to consolidate your knowledge and also to empower you to take effective action. It is very important to understand the various solutions so that you can choose the most appropriate methods for your own individual circumstances. We have emphasized the importance of gentle morning movement, which helps to lubricate your joints and also improve your circulation and also to reduce stiffness. We also explored the importance of targeted stretching, which helps to improve flexibility and also the range of motion of your knees. We discussed heat and cold therapy and their different applications, where heat helps to relax muscles and cold helps to reduce inflammation. We also explored the importance of maintaining a healthy weight to reduce stress on the knee joints and also to reduce inflammation. We also discussed the benefits of supportive aids and how they can provide extra support and improve your mobility. And finally, we emphasized the importance of consulting with a healthcare professional for an accurate diagnosis and a very tailored treatment plan. All of these various strategies offer you a range of different options that you can explore and implement into your daily life, and all of these will help you to take control of your morning knee pain. It is about using all of the tools available to you so that you can live a healthier and more mobile and also a more pain-free life. It's also about understanding the importance of taking a very holistic approach that considers all aspects of your well-being. It is a combination of changes that will help you the most. And now, let's turn our attention to our final thoughts and also to some of the encouragement that you may need to take all of the necessary actions that are required to live a healthier, more mobile, and also more pain-free life. It's about acknowledging all of the challenges that you face, but also about empowering you so that you can meet those challenges effectively. It is essential to focus on the positives and to move towards the changes you wish to see. We want to reassure you that morning knee pain is a very common issue, but it is also a very manageable issue through all of the various lifestyle changes that we have discussed today. It's not something that you just have to live with or simply accept as a normal part of the aging process. It is essential to understand that it is not something that you just have to endure, and there are a wide range of different approaches that you can explore to significantly improve your quality of life. Your comfort and your well-being should always be a priority. It's incredibly important to remember that you absolutely do not have to let knee pain control your life. You have the power to take back control, and there are many different options that you can explore to help you to achieve that goal. You should never feel as though you are alone or as though there are no options available to you, as there are many very effective strategies that you can implement to help to reduce your pain and also to significantly improve your mobility and also to empower you to take charge of your own health and well-being. There is always a way forward, and it is vital that you maintain a positive mindset. We encourage you to take a proactive approach to managing your health and to incorporate all of the different solutions that we have discussed today into your daily routines. Remember that it's about making a commitment to yourself to prioritize your well-being and to take the necessary action to ensure that you are living your life to the fullest. It's not a quick fix, it's about an ongoing journey where you are taking action every day to ensure your long-term health. Small changes, when consistently applied, can have a huge positive impact on your life and on your overall health. You are in charge of your own health. And finally, let's move on to our call to action and also our outro. We truly hope that you have found this video to be incredibly useful and also to be incredibly informative. We would love to hear about your personal experiences with morning knee pain and also any tips that you may have that you have found to be particularly useful, so please share your thoughts and experiences in the comments below. Your feedback is always incredibly valuable, and it also helps other viewers to also learn from your experiences. We all benefit when we share our insights and experiences with each other. We would also like to encourage you to subscribe to our channel if you haven't already done so, and also to click that notification bell so that you never miss any of the valuable content that we bring you here at Vibrant Seniors. We are very passionate about all aspects of healthy aging, and we want to make sure that you are always receiving the most up-to-date information. If you have found this video useful, then please do not forget to like this video and also share it with all of your friends and family members who may also find it to be beneficial. The more people who are aware of these issues, the better. Thank you very much for watching and for engaging with all of this incredibly valuable information. Please always remember to take good care of your knees, and they will take good care of you. You have the power to improve your own well-being, and we want to encourage you to take that power and to use it wisely so that you can live a long and healthy and fulfilling life. It's about managing the present and about creating a brighter future for yourself. Remember that you are not alone and that we are always here to support you on your journey. Let's continue this journey together so that you can enjoy your life to the absolute fullest.